Her ears, and I'm going to check two parts of it, the hearing part and the equilibrium part. So cover this ear for me, this side. I'm going to say where you need to do this. Can't think of, I would say Walmart. There's got to be a new one.
Kmart.
So that's the whisper test, which checks the cranial nerve 8, which is the acoustic nerve, or some call it the vestibular cochlear nerve. And then I'm also going to do the Weber and Rennie, which still checks cranial nerve 8. This is the Weber. Just tell me where it lateralizes, or just down both sides. Okay. And then the Rennie I put on her mastoid. Tell me when it stops. So she said it stops, and then I put it in front. And air conduction should be longer than bone conduction. So all this is assessing hearing, the hearing portion of cranial nerve 8. But I also need to check the vestibular portion of cranial nerve 8, which is, let's do the semicircular canal. They're going to check her balance. So I'm going to have her stand up and do the Romberg for 20 seconds. And then close your eyes. Their feet should be about that far apart. Don't let them put their feet together. They'll fall for sure. Okay, so she passed, so we'll let you sit back down. And what I'll usually do is, well, I've got this in my hand, I'll go ahead and do vibratory sensation, which is a sensory assessment. And I'll usually do that on one of the malleoli. Can you tell me when it stops? Okay. I did that a bit. It's a special thing. Can you hear it? All right. I'll put it on her malleolus. Close your eyes. Now tell me when it stopped. Did it stop? Yeah. All right. So that's vibratory sensation. So I went ahead. That way you can get rid of this and have it all done at one time. Now I'm going to check cranial nerve 1, which is olfactory. So close your eyes again. I'm going to put something under your nose, and I just want you to go ahead and sniff me. Okay. She identified coffee correctly. When you write this up for your final, make sure you put the number of the cranial nerve and the name. Okay, so don't just say cranial nerve 1. Say cranial nerve 1 optic. It helps you practice. Helps you memorize. Okay, in the mouth, you like when you do this, and open your mouth for me. Say ah. Say ah for me. All right. Say ah. You say ah. Ah. There you go. I know you had a test. So when she said ah, the uvula soft palate rose midline, and that's cranial nerve 9 glossopharyngeal. And I also could gag her, but I'm not going to do that. Okay. And which would be 10. And then we've got to do the tongue, the strength of the tongue. Stick it out, side to side. You can open your cheek. Strength of the tongue. That's cranial nerve 12, which is hypoglossal. To the other side. So if she's had a stroke, it might not be equal strength. Her neck is symmetric. We're going to do this. Since this one, you didn't do musculoskeletal when you did the midterm checkoff, so we've got to put the musculoskeletal on this one. So, although you already did range of motion, so chin to chest. Now that's also Koenig's sign. Does that bother you down your neck or down your back? Okay, so that, excuse me, Brzezinski's. Yeah, that's Brzezinski's. Chest for meningitis, so that was negative. And then look at the ceiling. Look at the ceiling. Okay, and then look to your side, other side. And then lateral ear to shoulder. Full range of motion over neck. And we'll go ahead and do range of motion. All right. Shrug your shoulders real tight. Don't let me push it down. Okay, that checks her trapezius and SCMs, and that's cranial nerve 11, which is spinal accessory. Okay. And you can also press your cheek against me. Because I'm shaking. This is straight. That's still cranial nerve 11. I'm going to do upper extremities first. So let me have you stand up to check your shoulder range of motion. It's kind of hard to do that sitting down. Okay, so we'll do one arm at a time, which is flexion. I'm going to go ahead and go all the way around and do circumduction. All right, and so when she's got it straight like this is extension, and backwards is hyperextension. And also, can you put it up over your head? A lot of little ladies have frozen shoulders, and they can't raise their arm up any higher than this. Anytime they get a shoulder injury, you always watch out for that shoulder range of motion because they can really get impaired, can't reach up any higher than this. Really, they can't get their cans of food. Okay, so we want to do both shoulders, so let's do this one. All the way around circumduction. Okay, and then abduction, all the way over your head. Adduction, and that's hyperextension. This is extension. She's being hyperextension right now. I'm going to go ahead and check her shoulder strength. Go at this one. This is a quick way just to do shoulder strength because it's okay. That checks her shoulder and her deltoids. I'm going to check her bicep strength. Go at this one. Don't let me pull them down. Now push against me. That checks her triceps. And let's do elbow range of motion. And you want to inspect and palpate each joint as you do the musculoskeletal exam. Let's do your wrists. So this is flexion, extension, and hyperextension. Let's do your fingers. Flexion, extension, and hyperextension, and abduction and adduction. Adduct your thumb. Look at this for me. Okay, let me check your strength. Go by this. Okay. Squeeze. Remember when you do this to cross your fingers like that. Don't do that, it'll hurt more. Do like that. Little trick. Let's see. Now I'm going to go ahead and check pronation and supination. This also checks wrist range of motion, and that also checks proprioception. And let's do this. Okay, there's finger to thumb, which is a proprioceptive test. And arms out all the way out. Close your eyes and touch your nose. Still doing proprioception. Your arm. Keep your eyes closed. There you go. All right. And then you can also do her finger to her nose to your finger. You can do that one. It's kind of odd to go back to you if I do that. And I'm also going to do the position or kinesthetic sense. So close your eyes, and I'm going to put your finger either up or down. You tell me if it's up or down, okay? And I can also do that on her toes, but usually just do it on the fingers. And I'm also going to put something in your hand, and you tell me what it is. Both, right? You can feel it. So this is called stereognosis. What is it?
What do you call it? Lack of words.
Safety pin.
There you go.
She called it a pin. She brained it from the test. All right. Now I'm going to draw a number in your hand, and you tell me what it is. 3. Okay. So she got graphesthesia, correct? And I need to do 2-point discrimination. Just open up your paper clip, and you know the procedure, don't you? 2 points and 1 point for my side. Okay. So I'm going to put this on your fingertip. You tell me if it's 1 or 2 points.
1. 2. 2.
You should be able to get to within 2 millimeters distance, and she should still be able to say it's 2 points instead of 1. So that's called 2-point discrimination. And there's no Heberden's nodes or Bouchard's nodes. It looks like osteoarthritis. That was a test question this morning. She doesn't have any ulnar deviation, which is rheumatoid. Now I need to look at her the chest. It's symmetric. Her apia transverse is 1 to 2. Okay, so I'm going to, and then you're going to, whether your patient's male or female,